I would say our main strategy has not changed. I mean, we have always tried to be there for all the hemophilia communities that were involved in treatment and providing good care to patients with hemophilia. We have always worked very closely with patients' organizations in Europe, in US and all that, and we are also working very closely with doctors' associations, hematologist organizations and so forth. And so that strategy does not change. We need to be there, and we need to keep on doing that we've been doing for a long time. I'm quite sure that it is something that is very much appreciated by the medical community, by hematologists. And therefore I don't see any change in strategy. We will keep on doing that. We will keep on facilitating that doctors, healthcare professionals get a better understanding and knowledge about how to treat more broadly, more excessively for the benefit of the patients, really changing the possibilities for the patients.
Continuing? Yes, I think the success of this meeting in the last 9 years means that it will continue for the future every year. The expectation for Novo Nordisk is that in 1 year's time there will be another Gulf Symposium and that it will be well attended, and that there'll be new products even to talk about that will have been launched even in the area. So hemophilia is an inherited bleeding disorder. It's the most common inherited bleeding disorder, hemophilia A. It is inherited as a sex-linked disease, so the mother is the carrier. And as we've heard today, that's very important. The mother is very involved in a variety of issues with the child, not just the usual child rearing, but also has some guilt and sadness about having been the cause of the disease. In any event, the child has a bleeding disorder that 20 or 30 years ago was terrible and did not allow the child to live into adulthood. Now, with treatments that are available, children can essentially live a normal life if they are given enough of the replacement therapy for their disorder. So we've moved from a terrible genetic disorder that is going to cause the death of the child early on to a disease that can be managed in the right hands, and we have here among us many people who are very capable of taking care of the disease with the right amount of product and the right therapeutic approaches. So it's a time of great hope for hemophilia today.
The conference of today is the 9th Symposium for the Hematology Management. It's sponsored by Novo Nordisk company. The main objective of the event is to share the most recent update about the management and diagnosis of this disease. We have a lot of experienced people from different Western European countries. All of them are sharing with us locally, the Gulf staff, what's the most recent update about management of hemophilia. The expected result of this symposium is to get new approaches, new methodology in the diagnosis and management of hemophilia disease, and to share the best practice from other countries to be applied here locally in the Gulf countries.
In Novo Nordisk, it is not only just selling of products, which is Novo 7, which we are proud of. We also take pride in taking care of patient population and the healthcare professional who are taking care of these patients. This is actually a platform which we have created, and this is the 9th time in the row for discussion and debate about hemophilic populations, because this is basically the rarest of the diseases which normally doesn't come into the limelight. We as a company are very passionate about it, not just because we are selling it, but because it really brings a difference to the life of the patients. And what we expect as a company is that this platform will throw much more light in terms of creating awareness and also the treatment paradigm which is evolving in this particular area.
So yes, I think this meeting here in Dubai, I think it's a great opportunity to learn and to share experiences for treaters, but also for any other stakeholder that we work with. And I really believe that opportunities like this Gulf Symposium that we're attending here is a wonderful initiative that's also very much fitting into our ambition to change possibilities in haemophilia for all people living with haemophilia, to also have them leading the life that they aspire to live. All right, so I think right now we have a lot of people living with haemophilia have a lot of challenges. And actually we from Novo Nordisk, we looked into that with our HERO study. So beyond basically factor treatment, it was also looking at elements such as psychosocial care that's needed for patients like that. So things like relationships, finding employment, finding also their place in society, access to factor, that was elements we looked at. And we really identified a set of unmet needs within those patients. And I hope that also by educating the society, but also other stakeholders and people we talk to about haemophilia with conferences like this, that we can really change their possibilities to live with haemophilia.
But I do think that Novo Nordisk is a very good partner for physicians and for patients. And of course we work in sort of a pyramid. We strive to improve treatment because right now lots of people don't even have treatment for the bleed. So we want to improve treatment for patients so they get quick, efficient stop of their bleeds. We also want to go a step further to prevent all bleedings. With, for example, long-acting prophylactic therapies, so you can give, doses frequently, so you never even have a bleed. And then, of course, the ultimate is the cure, which we don't have a solution right now. But of course, it's something that we will also investigate and have our early research working on, because that's the ultimate goal. And you can say that some results from the academia, like gene therapy, is something that you could consider towards a cure.